And good evening. It is Sunday night again. And I'm, of course, Dr. Mike Sevilla, President of the Ohio Academy of Family Physicians, and welcome to Bite-Sized Learning. We have a great guest coming up. But I did want to remind you about just a couple of things here, just on our OhioAFP.org website. We did have our Supreme Court candidate forum last week that was recorded live, but you can see it kind of on demand on our website there. And we have a great CME coming up in October to learn how the Opioid Response Network provides resources for family docs. There's also a great resource for the 2020 general election, a guide to voting in a pandemic. Get all that information at OhioAFP.org. So my guest, really happy to welcome him, the board chair of the American Academy of Family Physicians, Dr. John Cullen, is joining us live from Alaska. Hello, John.
Good evening. How's it going?
Good, good. Now I have to tell people that that is not a Zoom green screen. That is real Alaska from your front yard. Is that right?
That is correct. Yeah.
Oh, and it is 8 p.m. Eastern time here, and it is 4 p.m. where you're at right there. So thank you so much for the time tonight. I've been really looking forward to talking with you. And before we kind of start into things, I just wanted to just publicly just thank you. You probably don't remember, this is like 20 years ago at the Congress of Delegates, and you were speaking at a reference committee, and I came up to you and I asked you questions about whatever you were speaking about. I forget what it was, but you talked to me about that. You talked to me a little about the history, about what the Academy did. I think I was a new physician at the time, and ever since then, I'd see you at Congress of Delegates, and we chatted up, and just want to, just thanks for just being so welcoming and for answering my dumb questions through the years. And it's fun seeing you in this position now as board chair. It's just so much fun for me to see.
Thank you. And I do remember the conversation, but I can't remember what it was about either.
So just to kind of get things rolling here, just for those of you here in Ohio who don't know you and who are not familiar with you, just introduce yourself to our audience. We'll just kind of go from there.
Okay. Well, I'm John Cullen. I'm the board chair, which means that this is my 6th year on the board. I live in Valdez, Alaska. That's what you're seeing behind us. It's a town of about 4,000 people, and we're 300 miles from the nearest other community of any size, and the nearest tertiary care hospital is about, depending on how you do it, either 4 hours by airplane or 6 hours by car. And I have a full spectrum family medicine practice in addition to my activities with the board. And I've been doing both, actually. I've been delivering babies and chairing meetings with the Academy. So that's it's been an absolutely fantastic adventure, all of it.
But born and raised in Alaska?
No. Oh, I'm sorry. Can you guys hear the lawnmowers going off?
Oh yeah, this is real stuff here. I love it.
Okay, as long as it's not too loud.
No, it's fine.
I'm sorry, what was the question again?
Born and raised in Alaska?
No, Arizona. So
wow.
I guess I've been trying to run from the heat ever since I was a teenager or something.
So how did you find your way to Alaska then?
I came up here as a third year resident and just fell in love with it. And there's a short story and a long story behind that. But part of the reason why we ended up here was my daughter, who was 3 at the time, had this absolute fixation on orcas, on killer whales. And so I just thought it'd be great to go up to Alaska and maybe we could see some orcas, and just as a rural rotation when in residency. And like I say, we absolutely fell in love with it. So we just came back here that year.
Wow.
And I've been here ever since.
Huh. So you got a job kind of where you did your training as that third year resident, or how'd you get that job up there then?
They were desperate. It was I joined a husband and wife team, and they had been practicing just the two of them for a while, and so it was it was just nice to kind of join in with that. They were great mentors, so it was a good experience for me because I learned so much from both of them, and then there were some things that I brought with me just coming out of residency that they didn't have, and so it worked out. It worked out extremely well, and like I said, I just by and large really haven't been tempted to go anywhere else.
And what's your describe kind of your practice situation now?
So right now we have 4 family physicians in a private clinic, but we also cover the emergency room. That's actually what I'm doing today, which is why I'm dressed in scrubs. The hospital and my practice are about a mile away, so I walk to work, weather permitting. And
Right.
and then in addition, we do full spectrum maternity care. I deliver babies. We do C-sections. Sometimes we do the anesthesia. Yeah, it's just a whole spectrum because there's really not anybody else here.
Right.
So there aren't any specialists. There are. We do have another family physician. One of the physicians in our group started their own practice, but we work pretty well as a team. And that's it. Yeah. So there's really, we cover an area that's huge. I always give Gary a hard time, Gary Leroy, that the area that I cover is about the size of Ohio, but and it actually is. But that's but most people in that live right here, and so it's just very sparsely populated.
Wow, man. So how did you come to choose family medicine as a specialty?
Yeah, I was one of those students that I just loved everything. So I really enjoyed surgery, emergency medicine, obstetrics. I couldn't really see giving any of those up. I think the original plan, was to go into pediatric oncology, and I'm really glad I didn't do that. But the cool thing is that I get to do all of that here. I do the ER, I do some surgery, I do obstetrics. It's actually I'm just doing all the things that I loved when I was in medical school.
Yeah. Oh, yeah. Yeah. And you have medical students that visit you up there. Is that right?
That's correct. We have medical students and residents both. I have a medical student right now from Dartmouth, and we had a resident from the Anchorage program with us this last week, which is really great. I have to admit, I just love teaching students and residents. One, it's just you get to see it through their eyes, which makes it all new for you. I think that's really cool. They also are up on the latest stuff, which is great to pick their brains. And beyond that, it just makes it fun. I was a little worried that my patients wouldn't really appreciate it, but they seem to love it. Although I did have one patient ask the medical student, what did you do to get assigned here?
Well, I know a lot of like AAFP, student leaders and things have come up to see you, and it's like a whole experience, isn't it? Like they stay with you, they work with you. I mean, it's a whole kind of immersive type of thing, isn't it?
Right, and that was the whole intent. Is that we really do want. It's more than just the academic side, but we talk a lot about work-life integration and how do you survive the stresses of medicine. And so my wife actually taught nutrition for years, so we do a lot of healthy cooking, a lot of exercise, because I think that's for us, exercise means hiking up in these mountains or kayaking or sailing or something. We drag them along everywhere we go. And I call it work-life integration because, a lot of the stuff we do during the day, and I'll take students up skiing, for example, in the morning, and then we come back by noon and then see patients for the rest of the afternoon. And or we actually take a 2-hour lunch every day so that we can go out and go skiing, cross-country skiing for an hour and throughout the winter.
Wow. Well, yeah. I mean, I'm so jealous, because if you follow, Dr. Cullen on Instagram or Facebook, you see all these just fabulous and envious pictures of him just taking it easy after a day at the office. You see him skiing, or you see him on a boat, or see him out somewhere. It's just, I'm like, oh man, that's kind of cool.
Yeah, one of the things that I learned from one of my mentors, Andy Ambig, is that you have to have an activity for every weather condition.
I see. I see. Huh. Yeah, I've heard, that Alaska, is it just like two seasons, or just like winter, and then there's like, maybe a week of spring and maybe a month of summer, and then a week of fall, and then it's back to winter again? Is that how it works up there?
Oh, I think the problem is that other people would see that it's winter and summer, but it's really not. It's so spring for us is the most amazing ski days ever. It's sunny, and it's sunny until late in the evening. So March, April, May are just absolutely incredible. And but there's still snow on the ground, but it's warm, sort of. I mean, after having gone through the winter. But we can sail and ski in the same day. And the trifecta is going cross country skiing in the morning, and then downhill skiing in the afternoon, and then sailing in the evening. So if we can get 3 sports in one day, then we know that we've been hitting it hard.
Oh man! And you are looking for an attending doc, to come work up there.
Yep.
I mean, you're always recruiting, aren't you?
Not always, but it seems like a lot of the time. Yeah, it's we do really well at recruiting people for 3 to 4 years, and then but it is far away. I mean, that's one of the downsides. It's far away from family.
Yeah. So I mean, you probably get a lot of questions about, how is Alaska kind of family medicine different than in other places? And I've heard you speak on like wilderness topics and things like that. And I want to just share maybe just one or two maybe cool things that happen in Alaska that or wilderness medicine that don't happen in other places.
Well, so I would argue that they're probably happening just the same in Ohio. I know you guys have lots of rural areas in Ohio, and we have a model with I've been calling it a 4-family physician model of rural healthcare. It's hard to do it with less than 4. You can do it with 3, and you can do it with 5. But it means just having a really tight team to handle whatever comes in the door, and that means taking care of maternity care, taking care of emergency room emergencies, because we have no idea what's going to come through the door next. And I think that part of the reason what really got me started thinking about that is when I first got here, we had an emergency C-section. And it was a situation where we had to get the person, we had to do the C-section. We couldn't get them out. It was a true emergency, and we just weren't ready. And so we did a lot of, everything came out fine. Although my scrub nurse passed out in the middle of the procedure, and it was just my partner and I. It was definitely an experience I would never want to repeat. So we really started practicing for these sort of low volume, high acuity events. And that was before simulation was actually, something that was thought of in medicine. This is quite some time ago, but we actually brought out the Recessiani and did a C-section on Recessiani, I don't know, 50, 60 times over the next few months after that. So the next time that we had a real emergency, we were ready. And so we do that for OB, we do that for ER. And as a result, we're actually providing a really high quality of medicine for a community the size ours is, which is about 4,000 people. We have a really low infant mortality rate. It's less than the national average. Just in a lot of other measures, we're doing really, really well. So family physicians can provide this level of care, absolutely. And I really think that we are the answer for rural healthcare. I think that's even more important than necessarily Alaska healthcare, although this model is seen quite a bit in Alaska. There's a lot of communities that are doing the same thing that we are.
Right.
But it works the same in rural Ohio. And I think that that's something that we need to really kind of look at is how do we improve rural healthcare, and specifically about how do we improve rural infant and maternal mortality, which is unfortunately extremely high in this country. It's much higher than in urban centers. It especially affects those communities that are largely minority populations. And it's something that we can turn around. But the only way I think we're going to do that is with family medicine.
And is it really just kind of like a lot of, like preventative medicine to try to prevent like the mortality, infant mortality and maternal mortality on the back end? Is really addressing kind of those issues on the front end with family medicine?
Absolutely. There is definitely that. But it's a lot of it is vigilance and just really being able to watch over people. But like with maternity care, so a third of maternal mortality occurs during pregnancy. A third happens in the week around the delivery, and then another third comes in the year after the delivery. And so what that means is that the majority of maternal mortality occurs in the communities where women live, and 20% of women of reproductive age live in rural communities. And so we need to be ready to be able to handle those emergencies as well as to prevent them. It's hard though. I mean, there are times when all the prevention in the world does not, can't prevent everything. We just had a case, actually 3 weeks ago, where we had somebody with eclampsia, and there was no warning. Blood pressures were normal all the way up until when she came in with seizures. So we have to have that robust capability in rural communities.
And you describe things like simulations and things. I mean, what are the things that are your clinic doing to try to anticipate some of these needs or try to address some of the unique needs of your community?
Well, we're really in a lucky position because not only do we do our clinic, but then we cover the emergency room as well. And so we're providing all the maternity care within the area, and actually most people stay within the community to deliver. And that's, I think, partly because we have much more of a birth center kind of philosophy as far as the delivery room goes. And family physicians who are doing obstetrics have a very different model, I think, that by and large, and you see that across the country. And but it's a little bit more of a birth center kind of philosophy than it is a rigorous hospital kind of philosophy. Beyond that, we try to make sure we get people in a hurry, that we make sure we have follow-up. It's easy for us in many respects because we know everybody. For a while there, actually, all of my MAs were married to pastors, priests, things of that sort. So all the religious community, which was great because we had a real window into what the community was up to and how people were doing. And so we have lots of ways to check in on people and make sure that they're doing okay. And we take care of kids. So with the kids, we're able to follow up with the moms as well. So it really does work. It's really much more of a community feel.
Yeah, that's what I mean, and that's kind of what family medicine is just kind of being out in the community or the community coming to you. And I'm just trying to just think in my head kind of like what your kind of capture area is. I mean, you said, it's, maybe the size of is the size of Ohio. And, it's just that distance, is just so, it's hard for me to put my mind around. It's like, those are the communities and those are the people that you're taking care of as a family doc. I mean, it's a lot. It
is. Telemedicine has actually been really nice. That's something that's been a really nice addition, just all that technology around that. Because we do a lot of that as well.
Now, I mean, even before this coronavirus thing, were you guys doing that? Were you set up for that, or was it just like every other community that coronavirus really kind of exploded telemedicine where you're at?
Yeah, it's one of those things that I had been meaning to do. I was planning on working on it. And then the very last meeting I attended was the Hawaii Academy of Family Physicians right before everything closed down. And when I got back, had to go into quarantine for 14 days, which was a perfect time to set up telemedicine. So I think, but actually, if you look at it, like 60% of family physicians started telemedicine for the first time in March.
Right.
I mean, that's just an extraordinary achievement. It really is. And all of us had to figure out how this worked while we were doing it. As I've been saying, it's like we've been building the plane while we're flying it. And
exactly.
And so it was just an absolutely extraordinary achievement.
And it was, I would imagine, some, working through some workflow issues. I don't know if there were technology issues or internet issues, or were there some kind of issues unique to where you were at as opposed to other places in the country?
Yeah, so broadband was a huge issue for us. But luckily, the head of the local internet provider was just very excited about providing telehealth services. And so he actually got everything wired up. We finished getting everything done, I think, in January, before we really knew we were going to have to use it. But we actually have broadband over a huge area of Alaska, which is interesting because I know that there's a lot of places that have much worse telecommunication than we do out here, despite the area that we're serving.
Right, exactly. Yeah. And you're continuing telemedicine now, or yeah.
Though it's less. What's interesting is that initially I think that our patients were really excited about it. A lot of them just really want to be seen in person. But the difference now, though, is that we're really doing a lot of screening by telemedicine before we let people in the door, especially for any kind of illnesses. And actually, my son came back to town just for this whole time and set up a rapid COVID testing site right adjacent to the clinic. So now we can do a telemedicine visit, have them do COVID testing, and then come into the clinic. And that seems to be working pretty well.
Wow, that's great. I mean, I know where I'm at. It's difficult for me to get some rapid COVID testing. So it's just like it's so variable everywhere as far as access to the stuff and when you can get it and who's going to get it first and that whole thing. So I mean, how is the COVID-19 situation in your community there?
Well, as of Friday, we had one case in the last 2 weeks. We actually came through unscathed we're relatively unscathed with the summer. So we have fish processing plants, and so people coming in from all over the world. And we had about 850 fish processing workers from outside of Valdez who all arrived in June. And so we were really worried that we were going to see a lot of COVID. One of the things that we did, though, is that we grouped everybody into cohorts of 30 because they live in dorms, and so we just thought it would just take off in the dorms, and then that would be it.
Right.
But so all the same group of 30 would be in the same dorm rooms, eat together, and work in the same place in the plant. And we had to have we quarantined them as they came in, and then put them into cohorts. And we only had one cohort that got infected, and everybody in that cohort got it. But that was it. So we actually got through that pretty well.
Okay. How about like schooling in your area?
No, everybody's back in school.
In person.
Okay. But they're doing a good job of wearing masks. We actually had a mask mandate really early on. I think that helped. But the kids are actually doing really well as far as the masks go. And then anybody who has symptoms doesn't go to school, we get them COVID tested immediately. And that was one of the nice things about having that available is that, I think that the rapid tests aren't all that great as far as, asymptomatic people, but it's pretty good if you're just trying to rule out whether it's COVID or not COVID. And,
right.
And so we've been just being able to test people within an hour of when they leave school, and then get them back if it's not something that's infectious, or have them stay home, but at least we know it's not COVID.
Yeah.
So far it's worked. We'll see. like everywhere, I think that that our numbers in Alaska are increasing. I think we're about ready to hit another wave of this stuff. And my great fear, I think, is that we're going to see a combination of COVID, influenza, and measles. If you look at national immunization rates, they're way down, and
Right.
and so I just worry a bit about that, more than a little bit, actually. So that's something else I think as family physicians, we just need to really work on immunizing as much as we can, because I think if we don't, then we're going to see those repercussions in our communities.
Yeah, exactly. I guess on the line is Dr. John Cullen from Alaska and the board chair of the American Academy of Family Physicians. So, John, what drew you to just being involved in like organized medicine in the first place? You could just be a family doc and just like do your job and just keep going. And what drew you towards leadership medicine?
A really interesting question, and a lot of that. So I live in a place that is well outside of anywhere else. Like I say, we're 300 miles away from anywhere. I was really worried that the only other doctors I'd have a chance to talk to were my partners, and I didn't know if I was going to like them after a year or two. And so one of the best advice I got from one of the docs in Anchorage is that I should get involved in the Alaskan Academy, and because that way at least I'd have a chance to talk to other physicians, which I thought was a great idea. So I got started in that the year out of residency, but because it's a small chapter, there's opportunities for rapid advancement, as in if you don't say no
if you miss a meeting.
Yeah. I right off the bat, I ended up being in the leadership of the Alaskan Academy, and then actually was the president. I think I was the president like 2 to 3 years out of residency.
Wow.
Which got me going to the National Academy, which I absolutely loved, and made a lot of friends, and I really liked that national perspective. I think that was really, really important. I kind of have a theory about burnout, which is that one of the causes of burnout is not having any control in your life. And
right.
And so by being involved with a national organization like the AAFP, it really kind of gives you that sense of control back because of the advocacy and opportunities that are there, and taking stands and having policy. I know that for me, when I was going through some dark times, that really made a big difference. And it turns out that I like policy. Who knew? It's not really something you find out until you try it, and I actually really enjoy policy, and so it just seemed like a natural fit.
That's great.
I wasn't expecting to win, but I did when I got on the board, and I have to admit I wasn't expecting to win the position either, and it just kind of happened, and so here I am.
Yeah, for the the rank and file AFP member, they probably don't know the kind of the differences between like President-elect, the president, and board chair, and I've been lucky to have Gary and Ada on earlier this month, but I mean, just from your perspective, kind of looking back, I mean, just to describe what are kind of the differences between each of those offices after you win for President-elect?
So. The president-elect, you kind of take a year to learn how to be the president, and the president, you're really the face of the academy, and so that's really where a lot of the initiatives start, is really from the president. And so when I was president, I pushed really hard on rural health care. That's the Rural Health Matters was kind of something that came out of that. I pushed really hard on maternal mortality and infant mortality, and just really worked on that. Those are really the big issues. And Gary had his own ideas of what he was pursuing. Part of that had to do with the events that were happening at the time.
Sure.
And so for me, it was actually really useful because I come from a rural place. Rural was extremely hot the year that I was the president. And I don't know how the Congress of Delegates does this, but they seem to pick the right person for that particular year, a year in advance. I have no idea. There's like this incredible wisdom that is involved in that. Because when I was president, being rural counted enormously, and it opened doors that I don't think that would have been opened otherwise. I was able to testify in front of the Senate and the House, and I remember there was one time I was testifying, and I was on a panel with an oncologist, actually the head of the AMA, a surgeon who was the head of the American College of Surgery, and then somebody from a think tank. And all of the senators wanted to talk about rural issues, and so I spent 2 hours answering questions. The oncologist started calling herself a rural oncologist just so she could get some questions. The surgeon just was ticked. He just, and that's not what it was for. I mean, that really was not the intent of that particular panel, but that's just what it turned into. So it worked out really well for me. And I think that as far as a lot of I can't think of a better person to be our president, as we've been dealing with all the social justice issues as Gary. I mean, what a great choice. And as well as all the academic stuff. I mean, I think that if you want to see what the country is going to be going through, look at what the Congress of Delegates votes on 2 years previously.
Right. Oh, okay.
We can't seem to predict more than 2 years, but we're pretty good at 2 years.
Okay.
And so, and it's just this fascinating thing that I've been watching this now for a long time.
Yeah.
And if you look back on same-sex marriage, if you look on reproductive rights, we're about 2 years ahead of the curve.
Right.
So
yeah.
Anyways,
think about
for
that.
whatever that's worth, I really do think it's a real thing. So, as chair, it's a little bit different. It's it's more about how the academy itself is running. So it's not about the outward face; it's more of an internal face, and and so ultimately, I'm the one that has to make the hard decisions, and the unpopular ones. And so, for example, in cutting the in-person Congress of Delegates, that was my decision, and it was with the advice of the board and everything else.
Sure,
but
of course,
ultimately, the buck stops here.
Mm-hmm.
And so, this has been a really interesting year.
Like I'm just trying to think of the thought process, into that. Like you have all this, you have the board and you have staff and you have all this data and you have all this, but it comes down to, yay or nay. I mean, that's a lot. That's a lot to think about.
And it's not like, it's the board who's the one that comes up with the decisions. Right. I mean, as far as policy. And so my role is to run the board meeting. So I've had to learn how to do, the WebEx and Zoom and all that kind of stuff. So there is that part of it. But there's some things you can't wait on, to have a full board meeting. And we have an executive committee, which is made up of all the presidents. But like I say, if there's unpopular decisions that need to be made, then I've been the one making them. So you can blame me.
I've been told by multiple leaders that that the president-elect and the president are like more of the present, but the board chair kind of like looks into the future and kind of tries to predict where the academy is going or where the academy should be going. Would that be accurate or not?
Maybe. I think that we've been just really reacting this year. I think that this is we've had to really respond to some real crises, and so I guess that would still work for that, because we're still trying to make sure that we come out of this in a better position than when we started. And so we have some real opportunities. So for right now, for example, the Congress of Delegates is going to be virtual, and that's a shame and a real bummer, because I just love getting together with everybody. But it also gives us an opportunity for finding out new ways to engage our members and to do things a little bit differently. And so one of the things that we did is that we created a task force just to be looking at this prospectively about how things are going and how things can be better, and just what are the lessons that we've learned from trying to do this as a virtual program. And maybe that'll inform us for how we do things in the future. So I see this as a real opportunity at the same time. I mean, nobody would have wanted the events that have happened that have brought us to this point. But nonetheless, we're here. And so we might as well get the most out of it that we possibly can.
Yeah. So have you done much reflecting on kind of your time on the board since you're going to be stepping away and completing your term as board chair?
Oh, absolutely. Especially since I have to give a speech to the Congress of Delegates.
Is it done, or you still have to finishing up?
Oh, it's mostly done. And as far as this year, and it is true that as the board chair, I'm really focused on kind of what is about the academy itself, not about the issues as much as just how the academy is doing. I think that is a fair summary of what you do as board chair, and kind of where it's going. And I think that, like I said, this has been a tough year. It's been tough on everybody, but we're going to come through this. We're going to be coming through this just fine. There's a saying that this too shall pass. May take a little while yet, but we're going to get through this. And as Academy, we're going to be in a strong position. And I think that, it's really hard to predict where things are going to go over the next month, really, or 2 months. I don't think that anybody can make any predictions about where things are going to be, say on January 1st or January 8th. And so we need to be ready for whatever that is. And there's just a wide range of possibilities at this point. And trying to see into the future in order to kind of navigate that is difficult. But one of the things that I guess I've been reflecting on is so we do a lot of sailing here in the summertime. I'm giving you a preview of my speech, I guess, but we do a lot of sailing, and a lot of times you just end up being out in the ocean, and then the storm rolls in, and you have to deal with it. And one of the first things you do is you reef your sails, you bring them in and shorten them so that the wind is not pushing your boat quite so hard. And then just really keep that goal in mind of where you want to be. And then as long as you can do that, then no matter how strong the wind is, you can still go in the direction you want to go at the right speed, and still achieve where you want to be. And I think I'd like to think that in terms of what I've been able to do this last year has just been that. We kind of saw this coming, we got ready, and I think we've navigated it well. And that includes bringing in a new executive vice president. And we had a lot of changes this year. It was
oh yeah, a lot.
And so we'll be when all I think that I can see this going in a few different ways over the next few months. And COVID is not going away. We've got this for a while yet. And so we're going to have to be really good about doing virtual meetings. I think that is just absolutely going to be a necessity. Somehow we need to when we come out of this, we have to figure out how to incorporate the lessons we've learned about virtual meetings and include those with in-person meetings, and just to really democratize that whole process of having as many people involved in the academy and feeling like they have a say, and that the academy is working for them as possible. And I think that the technology is going to really lend itself to that. So I'm excited about that part of it. Boy, as far as like the Affordable Care Act and things like that, I'm really worried about that. But even if it goes down, then we're going to have to come up with something that's better. And I think that we can do it, depending on what happens with the election. I think that we'll be able to come up with a better program that covers more people, right? Because the fundamental goal is we want universal health coverage that's based on foundational primary care. That's the goal that we're trying to go to.
Right. Yeah. And that's always been the goal.
That's always been the goal.
Right.
And a lot of it is just saying it and saying it and saying it and pushing hard and just pushing hard. And yeah, but I think the technology is really coming along that is going to allow us to do the same care anywhere you are in a rural community or in an urban setting. It's going to be the same level of care as long as we can get the finances behind that. And but I think we're going to do it. So unfortunately, it's kind of one of those things that we have a dysfunctional healthcare system. It's kind of like somebody with a drinking habit. When do people stop drinking? When things get as low as they possibly can be. And I think that unfortunately, we may go through a period of time where things are going to get worse before they get better. But we're going to fix it.
One way or another, we're going to fix it. You're right. Is there anything about your board of directors experience that that surprised you, either or you learned about yourself during this whole thing that you're like, oh, I didn't know that, or oh, that's kind of cool, or I'm just trying to get a little glimpse of what it is to have kind of like a board of directors experience.
So first off, I'd say that I have never been a part of a organization where the meetings are so incredibly well run. And I'm not saying that as board chair. I mean, really, I've known this for the whole time I started. It's just there's a board culture that is it's this interesting combination of having fun, getting a lot done in a short period of time, being incredibly focused. It's not the kind of thing where you can just sort of sit back and watch things happen. You have to be involved, and it's really intense. So that I really was not expecting it to be that much, I guess, of a growth opportunity, because I mean it really is. It's something that you really need to. If you're on the board, it's an incredible responsibility. You have to be at your best while all this is happening. So I think that was interesting. I got to know Doug Henley, which was he's an amazing man, and so I do feel sorry for the next generation that's not going to get to know him like I did. I think he's really a prince among men, and just with incredible values, who lived his values, and yet was had a tremendous amount of foresight into where things were going. I love going to the chapter meetings. Family physicians are just fun. They're just great to work with, and it doesn't matter which state. And not that the family physicians are interchangeable by any means, but it really was great just seeing family physicians around the country, and just that we have this in common, that we have fun when we're together. And I don't care what state it is. We have fun when we're together, and it's not like that everywhere else. I went to an ACOG meeting, which was fun, and I actually gave them a really hard time.
I'm sure they gave you a hard time as well.
No, not really. No, not really. But I told them that they were never going to solve the rural maternal crisis in this country, but we couldn't do it without them, and we needed to work together. I guess that's not that bold of a statement, but it was interesting because they don't have that same culture of just having a great time, and that was true. Gosh, I've been in a bunch of meetings. And family physicians have the best time together. That is something. It doesn't matter what the forum is or whatever. It's just family docs just get along great.
I guess on the line has been the board chair of the American Academy of Family Physicians, Dr. John Cullen. And as we're starting to close things up here on our conversation, I just wanted to ask you, what advice do you have for chapter presidents like me, or for chapter leaders, or just for Academy members, as far as what's to come for family medicine, what's to come for the AAFP, next year following family medicine. I know you touched a little bit on some themes, but any advice for family docs or for family medicine leaders?
Well, first off, I think the biggest lesson from COVID-19 is that family physicians were used in every department in medicine. We were taking care of ICUs, we were taking care of labor and delivery units, we were setting up new testing centers. We were used in every aspect in medicine, and we're the only specialty that could be used that way. So that broad training that we have is really important, and that's and I think it's going to be really interesting to see what happens with the residents that are graduating now. Their experience has been very different, and
Right.
and that they have a much more broader scope than we've seen in a long time. I don't think they're going to go back. And so I think that it's really important as leaders that we come up with ways for them to really use all those skills that they've been honing over the last year. And like I said, this isn't going to go away anytime soon, so it's going to continue like this for some time. So I think that's one thing. I think the second thing is, and we haven't really talked about it, but one of the reasons why we've had such a hard time with dealing with this pandemic is that our healthcare system does not have surge capacity and the ability
Right.
to rapidly increase the workforce, which means that everything is being cut down to the very bone before this for economic reasons. And as leaders, I think that we need to really stand up against that. That you need to have that capacity building has to be built into any kind of payment system that we have, so that if we go through this again, which we will, I mean, this is just one virus. The world is connected. We're going to see more things. We have to have that capacity to deal with the next one, whatever that is. I think the third thing is that what's interesting is that we thought we were stressed before all this, right?
Right, exactly.
I mean, I think I look back at about just sort of I reminisce about the easy days of 2018, and,
yeah, exactly. Yeah.
And so somehow we've been able to deal with this, even though it's been really stressful. And I think that's so when we talk about burnout, I think that needs to be a part of the equation. Is that I think that one of the things that has come out is that as family physicians, we are really needed. And I think that is another part that prevents burnout, is having that sense of mission, which I think that we've had. As far as for any leaders within the academy at the state level, I encourage you to get involved at the national level as well. It's a tremendous perspective to have this. You see things at a local level, like I'm looking around my neighborhood, but then also this 20,000-foot level of the National Academy. And that perspective, I think, is really useful. Besides that, again, it's that feeling of agency, like you have control over your life. And so I think that everybody needs to get involved in advocacy. So I would encourage that as well. There is nothing more cathartic than yelling at your senators and representatives. Nicely.
Well, even your local people say, "Hey, this is what's going on in my town," and just be active and be an advocate for yourself, for your patients, for your community. Absolutely, yeah. I mean, I hear a lot, and I know you hear a lot, John. It's just like your family docs out there, like, hey, Mike, that advocacy stuff, that's for you. That's really not for me, and just trying to get them involved, just say, hey, we need your voice as well. We add our voices together, and we can all, kind of work together towards a common goal. And it's really not the time for family docs, for anybody to kind of sit on the sidelines as the world goes around us.
And if you have medical students or residents who want to get involved, boy, their presence is just gold. I don't know what it is, but you can open up doors in Congress so easily if you have a medical student or resident with you. So medical students and residents, don't feel like that you don't have any power, because you have way more power than I do in terms of advocacy. So yeah, don't hesitate to get involved. It's super important. And this is something that, as family physicians, we cannot stand on the sidelines. We have to be involved, and we can't let things being done to us or to being done to our patients. like I said, I think unfortunately that things will probably get a little worse before they get better, and it's going to be up to us to really change that course.
Oh man, just the time goes by so quickly. So John, any closing thoughts before we end our conversation here today? I mean, I really appreciate the time, and it's always great to see you. We'll all be seeing each other in person hopefully soon, but anything to kind of close up our conversation today?
I think first off, it has been a tremendous honor to serve you all through my time on the board, and now as finishing up as board chair. I have been so incredibly proud of the job that family physicians have done through this crisis. I can't even tell you. I have to admit, I've worried probably about everybody in our academy. So just be really careful over these next few months. We're not done with this, and I, like I said, one of the hard things about being in this position. It's sort of like you're the family doctor for the entire academy, and so I just worry about everybody. But I am so incredibly proud of the job that you guys have done, and you've stepped up to the plate during extremely trying times, and I think that that's something that everybody has seen, is that that you can put a family physician anywhere, and they can do a great job, and that we have one of the highest rates of mortality from COVID of any specialty. It's about 4 times higher than the nearest other specialty.
I didn't know that. Wow.
And but what that shows is that we've been stepping in and taking care of people, even at risk to ourselves. And so it's one of those things. Like I said, I'm just incredibly proud of what everybody's done. But I want you to be careful. Please be careful over the next few months.
That ends our program tonight. My thanks to Dr. John Cullen for being my guest. And you can always watch this and other programming here at ohioafp.org. And good night from Salem, Ohio, and Valdez, Alaska. So have a good night, everybody.
All right. Good night.